Welcome back to another episode of The Heart of Local, where we highlight local providers doing awesome stuff in their community. Today's guest is Amy Whitsa with WFMC Health. Amy, welcome to the show.
Hi, thank you.
So, tell me a little bit about your background and how did you end up at WFMC Health?
Well, starting with school, I attended Gonzaga University in Spokane, Washington for undergraduate, and I studied biology. I always knew I really enjoyed science and I wanted to study science in school. Didn't really know at the time exactly what I wanted to do with my biology degree, but I had an inkling I wanted to work in medicine, and I actually initially thought I wanted to be a veterinarian. And then I worked at a veterinary clinic for a while after I got that undergraduate degree, and I enjoyed the medicine aspect, but learned about myself that I really wanted to work with the people more so than the animals. And so kind of changed course and eventually went to Idaho State University in Pocatello, Idaho to study physician assistant studies. And then I had grown up in the Salem area. I grew up in Silverton, so I came back here to practice medicine because I wanted to be back in this area.
That's awesome. So, what is your role specifically at WFMC Health?
I am a physician associate. Formerly, we were known as physician assistants. That's another common term, physician assistant or physician associate. That sees I'm in family medicine, but I'm not at the moment seeing little kids. I do ages 12 and up.
Okay, that's awesome. Now, do you speak other languages in addition to English?
I also speak Spanish.
Okay, that's excellent. Going back a little bit more to kind of the background and maybe even going back further, like when did you first know that you wanted to work in healthcare?
Hmm. I think part of I don't have a single moment that I remember where kind of a defining single moment, but um as I kind of briefly mentioned, I just always knew I really liked science in school. So I knew I wanted to do a career that was based in science. And my mom is a nurse practitioner, and growing up, I watched her do that. So she was an inspiration for me too. I think she's a big part of the reason I went into medicine.
That's great. I was going to ask if you had like one or more individuals that like really inspired you. So it sounds like your mom was that person for you. That's awesome.
Yeah, I would say so.
That's awesome. So when a patient leaves an appointment with you, how do you want them to feel afterwards?
Uh-huh. Well, first off, I definitely want them to feel like they were heard, like they were able to have their concerns addressed, or if not, if we didn't have time to address everything, that we made a plan for a follow up and for addressing things further. And I want them to um, feel confident in the recommendations I gave, and that they feel like they can trust the advice and the any advice that I gave or medications I prescribed or what our treatment plan was, that they feel like they can trust that.
That's great. Do you feel like that's like what people are looking for in a healthcare provider? Somebody who listens, somebody who makes sure things are clear. I mean, what do you think are some of the deciding factors when people are looking for a healthcare provider?
Yeah, for sure. I think feeling heard is definitely, I mean, I know that's something I look for when I go to a healthcare provider. So I assume that's similar for the patients I'm seeing. And um, there is a lot of information that today we can access on our own just through Google and now AI, artificial intelligence. So I think just really having that trust piece is important, having someone to help you kind of sort through all the information that's out there that can um, give you another perspective on, yeah, yes, I agree with Google, or well, no, that's not really, what we usually do, or kind of whatnot.
Right. the Google and AI overviews and things like ChatGPT are definitely changing, how people approach medicine and patient care for sure.
Mhm.
What do you what do you say to that? When somebody comes in and they've looked something up on Dr. Google, right, uh, or on an AI platform. How do you guide them through that process versus maybe what your recommendation and all of your experience would be?
Well, I guess it kind of depends on whether I agree with what Google recommended or not. If I agree, then it's pretty easy. Go, yeah, I think that that sounds accurate. I would say, that I agree with that, and we should go ahead and treat you accordingly, or whatnot. And if I don't agree, I try to give people the reasoning behind that. Like, well, yes, but maybe your scenario is a little, this situation is a little bit different for XYZ, or maybe we want to start with this. And then if that doesn't work, we look at we start going down these other routes. Um, so I think to summarize, just being really clear with communicating what we're doing and why we're doing it. If we're not doing what Google says, then okay, why are we not doing that? And kind of explaining that.
Yeah, no, that makes total sense. So, what what do you love most about your work?
I think I love most after I do get to know people and have that relationship with them. I love seeing patients on my schedule and getting excited to chat with them and then see how um, they're doing. And it's really fun when people have chronic medical conditions, like for example, diabetes. That was something I didn't mention, but prior to being at WFMC, I had specialized in endocrinology and diabetes management, and that's a little bit of a passion of mine is helping with chronic disease management. And I think that it's really fun getting to celebrate some of those little wins with people when they get their blood sugar lower, or they wanted to lose weight and they were able to lose a little bit of weight, or get their blood pressure under better control, or whatever it is. I really like that.
When I mean, it sounds like you've got some real motivating factors there, and you love to see your patients on your calendar and reaching their goals. What gets you through tough days?
Yeah.
Yeah, is that what gets you through tough days, or are there other things?
Uh, Honestly, coffee is part of what gets me through tough days. Coffee and chocolate. Um, I think, yeah, the patients are what part of what gets me through tough days too, and also my coworkers. I really enjoy our whole team here. I haven't been here very long yet. I'm pretty new to WFMC, but I already know what a fantastic team we have here, and really that makes a huge difference when you have coworkers you can rely on and who kind of help you get through those tough days.
Yeah, that sounds like it's a really important part of being part of the WFMC Health team. That's awesome. Why would you
Hmm.
why do you think WFMC Health is a great place for patients and patient care?
Um, I would say WFMC Health is a great place to be both as a patient and a provider because um, really the mission here truly is to provide good patient care. Um, Not necessarily. I think this is a little bit of a tough question to answer, just as far as trying not to um, say anything negative about other organizations, but sometimes really big organizations are more looking to um, generate more revenue so they can grow or expand, or um, yes, part of healthcare you need to make money, but I think ultimately our mission, our underlying mission is not to make money. Our mission is to treat the patients and to serve the community. And that's part of what makes this place so special.
That's great. Switching gears a little bit, Amy, into just some fun personal stuff. Um, what are some hobbies or interests that you have that you enjoy outside of work?
Well, I have a 2-year-old daughter. And so much of my free time is with her and also my husband. And we spend, for people who know Salem area well, we spend a lot of time at the local children's museum, the Gilbert House, which is fun. Lots of going on walks and trying out different parks and spending time at the library. And I also play indoor soccer, and that's something I really enjoy that gets me out, getting activity, but I also just love doing it.
That's great. So I was going to ask if there was anything that maybe would surprise people about yourself, and you just mentioned one maybe that may, if they don't know you like soccer, that you like to play indoor. That's awesome. Is there anything else that you would say like that would maybe surprise people just about you or your family?
Sometimes when I'm asked to just share like a fun fact about myself, I will mention that I did pole vaulting for a while. I think that's kind of maybe unexpected. I wasn't very good at it, but that was something fun I used to do in high school.
That's great. That always seemed very difficult to me. So congratulations on that. Oh, so awesome. Well, is there anything else you'd like to share
Thank you.
just about your role at WFMC Health or about working there or just what, again, anything else to add kind of in closing about your experience at WFMC Health?
Something that I think is a strength here is I think that at WFMC Health, we do a good job of recognizing that medicine is not black and white and that um, patients all have different wants and needs and, treating people where they're at. I think that that's something that we do a good job of here.
That's awesome. Well, Amy, thank you for sharing your story with us and appreciated the opportunity to get to know you a little bit better. And we're grateful for the care that you and your team provide at WFMC Health for the community. So thank you very much.
Yeah, thank you.